Welcome. I'm Darren Matthews from Joint Reaction Physiotherapy and Massage again. Today what we're going to be demonstrating is a technique called the Graston technique. The Graston technique is a soft tissue release technique using stainless steel instruments. What it's used for is to help with chronic muscle tension, break up scar tissue, facilitate healing, and get rid of trigger points and knots. Also can use it for ligamentous healing as well. So today what we're going to do is we're going to demonstrate the technique on the lower back. Somebody who has got a sort of a chronic tension problem on the lower back and some pain as well. As you can see in this gentleman here, if you just want to bring the camera in here, is he's got a lot of tension and tone in the back here. You can see just by the development here, lots of muscular development, and this muscle just sort of pulls on the low back, and because it's tight, and that can create back problems. So what we're going to do is we're going to use the technique and try to get rid of some of this tension, and basically see what the muscle tissue looks like after that. Here we go. Okay there, sir?
Yep.
Alright. So the first step in the Graston technique is to use what we call a scanner. So the scanner is basically this stainless steel tool, and what we do is we use a little bit of cream, and we just glide it upon the muscles here. Obviously steel on muscle is not a good combination, so what we do is we actually provide a little bit of a lubricant. So what we're going to do is we're just going to do some stroking of the muscles here, and we're looking for grainy or rough spots in the muscle tissue. That will show us there's a lot of tension, or there's sort of adhesions, or the muscles stuck together. And as you can see right now, it's got some reddening going on. This is actually called erythema, or just a reddening of the tissue where the blood's being sort of brought into the area. This is not abnormal in any respect. It's no different than if you were to rub your skin, you'll get red. But what we will start to see as we get into a little bit of a different tool, this is just showing us there's a bit of a problem in this area with the tension there, is that we're going to move to another tool. There's a whole bunch of different tools, and they're all a little bit different shape, as you can see, just for different body parts and different depths of tissue. So what we're going to do is we're going to keep doing it, and what we're looking for is this little red sort of stippling that comes up. And what that's called is called petechia. And that petechia is basically little blood supply that's caught inside scar tissue. And as you can see, you can start to see it as we start to press a little more. You can start to see this petechia coming up. A little stippling, it almost looks like a little bit of a rash. What we know is as we start to get that we're breaking up that scar tissue, and as we break up that scar tissue, it allows for that tissue to get a lot more loose, and also allows the blood supply to go into that area and to fix it. This is why this technique is so good for chronic problems, because most chronic problems are chronic because they're not getting good blood supply. Not having good blood supply means you can't get any blood or nutrients to the tissue, which means the tissue won't heal. Also, it won't allow for the tissue to be extended well, because it's all bound together. So this also breaks down those sort of cross-fiber adhesions that bind all the tissue together and allows for more looseness. As you see, I'm going to the other side now. We don't want them to be lopsided, right? And you can see, again, this is just erythema, nothing to be excited about. We do feel a little bit of a graininess down here, so we're going to switch tools again, and we're going to break down that scar tissue on the opposite side. How you doing, sir?
Good.
Good. This technique isn't overly painful again. Again, it looks a little bit scary, but really, it really just feels like a really deep tissue sort of massage in a very short time period. You can see again, nice amount of little petechia here. Once again, this is sort of signifying that we are on track and we're in the right spot. We do stop once we start to see that reddening, because that means that the tissue's had enough and we need that tissue to sort of rest, repair. But as you can see now, if you look at his back, look at the amount of movement in his tissues. Much looser. Much looser. Okay? So that was a demonstration of the Graston technique. Once again, I'm Darren Matthews, Joint Reaction Physiotherapy and Massage in Ottawa, Ontario. And come and check us out. Experience the difference.